is Dr. A proud member of S.D.A and Midwifery Training College at Asanta. This video is all about CPR, how to perform, when to perform, and why we perform CPR. CPR, also known as the Cardio-Pulmonary Resuscitation, is a life-saving technique that is useful in many emergencies such as heart attack or near-dying, whereby the heartbeat of a person stops. Giving chest compression, opening of airways, and giving a rescue breath to fill the lungs. One may ask why we perform CPR. CPR is performed to prevent brain damage and death. If the person appears to be choking, then CPR is not appropriate. But if the person is unconscious and appears not to be moving or making any moves, then you give your CPR. Ask how you can be of help to that person. If there is no response, begin the steps of CPR. Note that if the heart fails to beat, few minute delay before starting with the CPR makes the difference between life and death. Let's look at how to perform CPR for both adults and infants. CPR. First, check and make sure that the scene is safe and check the person's alertness by gently tapping the person's shoulder and asking,
"Are you okay? Are you okay?"
to see if there will be any moves or noise. Check for breathing. If the person is not breathing or gasping for air, open the airways by lifting the person's chin with one hand while pushing down the forehead with the other hand. Call 112 or ask for help if the person is not breathing. While waiting for help, begin with your chest compression. You begin with a chest compression by placing the heel of one hand over the center of the person's chest between the nipples and firmly compress to give at least 100 to 120 compression per minute. After the compression, open the airway by lifting the person's chin with one hand while pushing down the forehead with the other hand. If the person is still not breathing, begin a rescue breath by pinching the person's nose with your fingers and give 2 breaths strong enough to make the chest rise. Continue with the compression. Followed by the compression, continue to give 2 breaths for at least 2 minutes. Stop and check for signs of breathing, coughing, or movement. If there isn't any signs and symptoms, continue till there is a change. To begin with the CPR, make sure the scene is safe and check for the alertness of the infant by gently rubbing the infant's back or tapping the feet to see whether there will be moves or noise. Remember not to shake the infant. Check for breathing. If the child is not breathing or gasping for breath, call call for help. While waiting for help, begin with the CPR. Place the infant on a hard, flat surface against your thigh or on the floor. Begin with chest compression. You begin with a chest compression by placing 2 fingers below the infant's nipple line on the breastbone. That is the center of the chest. Firmly compress the chest at least 1/3 the depth of the chest. Give at least 100 compressions per minute, but hard and fast. Open the airway by lifting the infant's chin with one hand while pushing down the forehead with the other hand. This time, the head should not be tightened back as compared to adult because it can close the airway. To begin with the rescue breath, cover the nose and mouth of the infant with your mouth and give rescue breath strong enough to rise the chest. Continue with 30 compressions and give 2 breaths for at least 2 minutes. Continue with the procedure until help arrives.